Hey guys, welcome back to the channel. Today I have 50 of my best tips for labor, and I compiled these after supporting over 300 families in labor. They are in no particular order, but let's just get started. Rest in early labor for as long as possible. If your contractions are not to a place of intensity that you really have to work through them, then if you can deny them and rest, that's what I really want you to do. Don't time every contraction. Those timer apps are incredible for letting us know our frequency and duration. You can focus too early, and I don't want you to hyper focus on that app. I really want you to get into a groove of dealing with the contractions. So don't start that contraction timer too early, and don't time every contraction. Take a comprehensive childbirth class. Now, at the time that you put into educating yourself on how birth works and giving yourself strategies for labor will have a huge payoff when it comes to actual labor. I am a huge fan of preparing. Use the bathroom every hour or so. We want to give room for the baby to descend through our pelvis, and one way to do that is to make sure that our bladder is not filling up. We want to just go to the bathroom about every hour. Stay hydrated. So in between contractions, you want to take little sips of water. Maybe not between every contraction, but you should try to keep hydrated throughout your labor. Keep your jaw nice and loose. A lot of people hold tension in their jaw, and if you have a nice loose jaw, it can actually help your cervix dilate. Don't clench your butt during contractions. Sometimes you just can't help it. You just feel like that's the right thing to do, that you want to clench your butt. But we want to keep everything, especially everything, down low, nice and loose and open. Take nice, slow, deep breaths during contraction. That breathing pace, the nice and slow and deep, can really help with pain management. If you get an epidural, do everything in your power to take a nap after you get the epidural. Once you're situated and settled, turn the lights off, get your partner to nap, try to nap. Believe me, it's so helpful even if you can just squeeze in a little power nap. Don't tell your family and friends that you're actually in labor until you know you're in labor, until you're checked into your birthing location. You really don't want your friends and family to be blowing up your phone. And even a better tip, might be to give one person the job of being the point person to contact for updates, so that you and your partner are only updating one person, and then they're updating everyone else who needs the information. Change your positions every 20 minutes or so. Labor loves movement. When you change up your position, usually that's how it helps labor progress, and it helps the contractions get longer, stronger, closer together, which is what we want. Some of the positions that you want to take are restful positions. You don't want to do all of your positions standing or active. You also want to throw in some restful ones where you're sitting or where you're lying down as well. Make some of your positions asymmetric positions. So those are where one side of your body is doing something different than the other, like the Captain Morgan or the asymmetrical kneeling, or also as a restful position, the asymmetrical sitting position. I love all of those. Nourish yourself in labor. So as long as you don't have a restriction, like you have an epidural, if you're still able to eat in labor, it is so good to keep fueling your body. Have a variety of snacks with you when you go to the hospital, so that no matter what you're feeling, you can still have a choice that sounds good to you in labor. Use rhythm in labor. That gentle kind of swaying back and forth can really help when the contraction starts. Helps kind of give yourself a job and takes your mind off of what's going on just a little bit. Use vocalization, like those deep oohs and ahs. Something about those deep tones, making those when you have a contraction, can kind of take the edge off the pain. It's pretty magical. When contractions come, try to be aware of any tension that you're holding in your body and try to progressively relax yourself during contraction. You don't want to tense up, because that tension can actually increase the pain of the contraction, and the increase of that pain can increase fear, and it's just a vicious cycle. So nice and limp and loose when that contraction comes. It's hard, but it's really worth it. Use the shower. I feel like that's a bucket list item. If you can get in the shower in labor, definitely do. Turn the lights off in the bathroom, throw your battery operated candles in there, and use the power of water and that white noise. It's awesome. Bring battery operated candles to turn your bathroom into that peaceful laboring cave. Change positions during pushing. So you don't just have to push on your back, or you don't have to push on your back at all. You might want to try other positions like hands and knees or kneeling, or one of my favorites is side lying, because you can do that if you have an epidural or if you don't. Use those breaks between contractions to regroup yourself so you'll be ready for the next contraction. Things that's great to do in between contractions are take a sip of water, take a bite of food, have a bathroom break, shake out, maybe kind of move around. It's a good time to, if you want to change your position, if it's been about 20 minutes. So really use those breaks in between the contractions to your benefit. Close your eyes during a contraction. I've seen so many times that if you can just close your eyes, you can focus and kind of go within and use your coping strategies and not be distracted or overstimulated when you have that contraction. Just close your eyes. Don't try to talk during labor. Talking during a contraction, it really doesn't help you have the nice breathing that can help with the pain management. Encourage your partner to get involved in the preparation for labor. So whether that's a class or a book, going to classes together, having a partner that is prepared and ready to support is so valuable. Consider hiring a birth doula to support yourself and your partner. Birth doulas are experts and can really guide you and help you achieve the birth experience that you're hoping for. Use counter pressure to reduce the pain of the contraction. So counter pressure on your lower back is a great technique for partners to use for you to decrease that pain. Use the tub when you're in active labor or transition. The tub brings so much sweet relief, and you can see it in someone's eyes in labor once they get into the tub. So if you have access to a nice deep tub at the place where you're giving birth, definitely put that on your list of things to do. Find out if your hospital offers nitrous oxide, and then consider it as an option for managing your pain in labor. Choose a care provider and a practice that aligns with your desires for labor. Avoid getting induced if you have an option. Induced labor is often a lot longer than if you go into labor naturally. It can come with a higher rate of intervention, and it can just be more challenging. Set up your hospital room in a way to create a peaceful birthing environment that can have such an impact on your labor. Use a birthing ball. If you get an epidural, use a peanut ball. Ask your labor and delivery nurse if they can help you with it. Learn how to do visualizations before labor and practice them so that you can use them after labor. Talk to your partner about verbal support and what they can say to help encourage you when you're in labor. Practice these various positions for labor so that you have some muscle memories so it doesn't feel weird when you're actually doing them in labor. Practice breathing before labor so that when you are in labor, you have tried out those nice, slow, deep breaths, and it's going to feel really easy to do and very normal. Ask your care provider about benefits, risks, and alternatives to any of the procedures that they might be recommending for you. Don't ignore your intuition. Your gut can be really powerful in helping you make the right decisions for your labor. If something feels wrong, tell your labor and delivery nurse. Your communication with them is going to be so important, especially if you think that there is something wrong. You really want to advocate for your own care, and that also comes for when your baby is there. If you have something that isn't right or you're wondering about, don't hesitate to reach out to your care providers. Very important. When you're pushing, if you are being coached to hold your breath to a count of 10 and do that purple pushing style you might have heard about, if that doesn't feel right, talk to them about what you want to do. And just know that you do have a voice. Pushing doesn't have to go just one way. Use the forward-leaning position. It is the easiest position to get into no matter where you are and can really just take an edge off the contraction pain. Don't get discouraged if it takes a while to get into active labor. The early phase of labor is the longest. so that's going to require probably the most time and probably the most patience. If your labor starts at home and you're driving to the hospital in labor and your water hasn't broken, make sure you pack a towel or sit on a towel in your car. I have had many clients where their water breaks on the way to the hospital, so be ready. And then also pack a plastic bag just in case you feel sick, because vomiting in labor does happen. Now, if you're sure that your water has already broken, it's going to keep going. So wear a pad or wear an adult diaper to catch all that leaking. If you are low risk pregnancy, consider opting for intermittent monitoring. It's what the American College of OBGYNs recommends for low risk patients. IV narcotics are often referred as something to take the edge off, but just know that this option does cross the placenta and can have an effect on the baby. So make sure you get all of your information before you agree to that. Pooping while pushing, while it might seem embarrassing, it actually is a really good sign that you're doing a good job pushing. So try to reframe it into a good thing and not a negative thing. Work on your mindset before labor begins. If you are bombarded with negative thoughts, negative stories from friends and family, try to put those at bay and remember how strong you are and how your body really does know what to do. No matter how your birth goes, know that you are doing an amazing job. Those are my 50 tips. And since I talked a lot about positions, I bet you'll love to see this video right here where I go through my top 10 positions for labor. See you next time. Bye.